I'm Dr. Rajiv Fernando, Chief of Infectious Disease at Stony Brook Southampton Hospital in New York. I always want to see things from my own eyes to understand how things are. It's a long trip, New York to Austria, then Austria to Beijing, and finally Beijing to Wuhan. 24 hours in Wuhan City. Very quick 24-hour trip. So about 10% of the population wearing masks, so it was just not that much. I just felt it was business as usual. I think there were a lot more cases at that time and it wasn't reported. And I think if they were communicating with the public and telling people, you know, there is this situation that is there, people would have been more cognizant. For example, that weekend when I was there, I said I saw only 10% of people wearing masks. But if those people knew there's an active outbreak that's going on, you know, people would have been more precautioned. They would have worn more masks. And also it makes it difficult because it takes about 2 weeks before you actually get the infection to actually show the symptoms. So a lot of people were probably walking around downtown Wuhan who were actually infected, but they weren't showing signs and symptoms. Now, the lockdown measure, really, this is the first time in recent history that we've actually had a so-called lockdown. Back in the 13th century is when we had a plague outbreak all over Europe, and that's the last time they used a lockdown. So I think there's certain benefits and more disadvantages, I would say. They've cut out the public transport, buses, trains, you're just at home. Even the people who are not infected, who are healthy, they are forced to be with infected people and they get infected. I think it's a huge human rights violation. My approach as an infectious disease specialist would have been escalating, you know, contain certain situations, say, all right, this is where we are, let's start going higher and higher and progressively upwards, as opposed to just locking down. This virus over here, we're closing in on 4,000 cases in less than a month. So this is, I feel, much more infectious than SARS. We're just at the beginning. We're going to be a lot more cases. And I think in the United States also, there are going to be so many more cases. The only way to minimize is really wearing a mask, hand hygiene. How good is hand washing? Usually at least 20 seconds. Staying away, if you know someone's got the virus, just stay away. Avoid unnecessary contact. I personally feel a mask is enough at this point, but when they go to the hospital, healthcare workers are a little bit more cautious, so they're in appropriate clothing, mask, and they do wear the visor, which prevents eye. Might be some coughing which goes to the eye, or might be spread to the eye, so we don't have all the answers. So I think it's reasonable in this situation to use more precautions. Better use more than less, and later on regret